fearless cheerleader, but I want to tell you how much I love Vero Beach and this conference that John and Boris put on because it's life-changing. Wouldn't you agree?
Yes.
I can't hear you.
Oh, yeah.
Okay. All right. Well, I want to, Deborah Schiller and I are just thrilled to be here, and we want to share our experience, strength, and hope with you about PineGrove. And PineGrove is just an amazing facility located in Hattiesburg, Mississippi. And what really sets us apart from anyone else is that we're an extension of the largest county hospital in South Mississippi. We're a not-for-profit hospital. It's a level 2 trauma center. It has 512 beds. And it's just a wonderful component that we can be an extension of. We have several programs, but a few things that I want to hit on, and then Deborah's going to share with you some phenomenal things that we're tobacco-free. We've been tobacco-free for quite some time. The things that we do, 3 things that we do better than anybody else. Well, we are a medical facility, so we get those really sick patients that come in, and if they need to have medical attention, they're given it right on spot. We can transfer them to the medical center without, I mean, it's just an inter-hospital
Can I tell
transfer.
a little story about that?
No, in a minute, hold on, because I'll forget what I'm about to say. So, I mean, we get people that have flown in on planes, have gone straight to the emergency room, and then started their journey with us. One of the other things that we have is we have psychology internships available at PineGrove Behavioral Health because we're a full-service behavioral health hospital. We have a psychiatric intensive care unit. We treat adolescents short-term for our catchment areas. But I want to tell you why I came to work for PineGrove, because I was a referent before I came to work for PineGrove. I've been there almost 7 years, and it's been 7 wonderful years that God's given me. And I knew if I got my patients to PineGrove that they would get everything that they needed under one umbrella, and we didn't have to transfer them here, there, and yonder. So those are our gifts that we are able to offer our patients when they come in. One of the things that I want to talk about also is our alumni program. When I first came to PineGrove, I was hired to set up our alumni program, and several of you have asked. We have this dynamic duo called Carver Brown and Lauren White at PineGrove, and they're over our alumni program now. And we have, they have set up these wonderful quarterly events called Days of Hope that our alumni come back, and it's really grown to be quite successful. But what they do have are the outcome studies that we have been talking about here this week. Some of us have about our alumni and what's successful, what works, what doesn't. But Carver was just recently elected to be the executive director of TPAS. Some of you may not know what TPAS is, but it's the alumni, really the Alumni Association of all treatment centers. And it's where they come together and collaborate and share their experience, strength, and hope, so we can be one unity of people helping others with our alumni. So I just wanted to share that, and then I'm going to turn it over to Deborah.
You never wrote what your team.
Chop liver here.
Yeah, she's chopped liver. But you know, one of the things that we did do about a year ago was that our passion was called to open up an older adult boomer program. And that's called our Legacy program, and it is for adults that are 60 and up. And we have worked with the pricing on it. 60 days of this program is $30,000. That does not include detox, but we can bill Medicare for their detox. So that's one of our most exciting programs. And that's, many of you know Caroline Smith, who's over our intensive workshops. You know, she goes all over the world, doesn't she, John? I mean, she's on a plane every week, it seems like. But what she is able to do is she works a lot with interventionists and families and things of that nature, but she helps the whole family get into recovery and really makes a difference with those unique intensives. She calls them UTIs. I would think that that's a urinary tract infection, but she calls them unique intensive units. So that's Caroline.
They're
but
both.
Do what?
They're both.
They're both, yeah. So, but you know, if you ever need to partner with us on anything, we're here, you know, just like you are, to help the suffering addict from many addictions. And we have many different levels of care with PineGrove because we are a full-service behavioral health hospital, and we have 5 specialty programs. And we have a women's center that's 18 and older that treats chemical dependency and eating disorders. Our men's Next Step program is for chemical dependency. It's 18 to 59. We we have an impaired professionals track as well on that program. And then Deborah's going to share with you her experience, strength, and hope. And she is a first-timer here, so give her a round of applause. And that's what she did the first time I met her, the happy dance.
The happy dance. Well, I am happy. Ruth Ann flew in here with me and said, now I was saying, what are your tricks for learning how to remember people's names? How do you do that? And she's like, well, here's some ideas. She said, really, Deborah, forget all of that. The people that you meet here will become your friends for the rest of your life. It's like, all right. That sounds like just exactly like something Ruth Ann would say. But it's really true. This is a very different kind of conference than I'm used to going to, with all the intellectuals reading off all the statistics of all their research and that, and it's just, there's such a different vibe here, and I feel like I belong here, so I'm going to have to battle it out, although I want other people at PineGrove to experience this. One of the things that I really love about PineGrove is that when somebody calls there, the call center is really gifted at what they do and getting the information, and then they call the directors together, the different programs. And does this person need maybe 45 days of chemical treatment and then 45 days of sex addiction treatment? Or maybe this person needs 45 days of sex addiction treatment and then move up to a personality disorder treatment. You know, they'll say, this one's a pepper, that means the professional enhancement program. If they can tell the way they treated them in the call, whether they're going to need some feedback about their personality.
And that's our program for Disruptive.
Right, right. So I'll tell a little bit about that. We have, my program is called Gratitude, and it is the program to treat sex addiction. It was a program that was founded 10 years ago by Dr. Patrick Carnes. And that is why I came there with him. I worked with him before coming there. I really do think it's the top place for someone to go who has a sex addiction. And what I want to tell you is that we are really big at sending people on for more care from where we are. So if you have anybody at your place, if you're in extended care, transitional living, if you are in the business of transporting people to us, doing interventions, and you have anybody on your staff that's been trained to work with sex addicts, please let us know. We're always looking for somebody. We are 45-day minimum up to 90 days, and at the end of that time, they're just getting started with their recovery, and we know it. So they often need to go and address their eating issues. They often need to go and address their trauma. They often need to go and just learn how to live a life. And people who have chemical addictions have lots of places to choose from to go and have that done. But our patients, we need to know that there's somebody on your staff that at least believes that sex addiction is a real thing. Often I hear people say, oh man, sex addiction, that's a disease I wish I had. It's like a joke. And it's like, oh, it's an excuse. You know, somebody's having an affair on his wife. He's going to come and call it a sex addiction and go to some spa where he can kind of hide out until she cools off. But if you sit in the rooms and hear the people that I work with talk about, you all give their first step. You can no longer believe that they had any power over what happened in their lives. These are just incredibly loving, interesting, dynamic people who have done a lot to make our world a better place, but they are really screwing over a lot of people in their lives too. They're hurting anybody who tries to love them. You can see I have a lot of passion about this because, you know, the children in their families are suffering, the spouses are suffering, and the women of the world are suffering because of the way that many of the men that come there treat them. And yet they come to treat them and you see the goodness in them, and what they really want in their lives is something different. And I admire them so much, the courage it takes to come in and fly down to southern Mississippi, go into we are not a spa, we are rustic. I don't know how to say
We are not rustic.
We are very...
We're very southern.
Affordable, very affordable, I'll put it that way. And, but what they're walking away from in order to change every single thing about the way they live their lives, my hat is off to them on a daily basis. And to see how their families can change, how they can change. We work very closely with their families. We're talking to the spouses, the children, every week. We're bringing them in
Our
for a
family
whole
program.
family program. It really kicks it. It is often I say it was the most powerful week of our whole treatment stay. What happens there? In fact, the thing can I tell a story? Can I tell a story? We were doing a disclosure, which is where you sit down and the person sits across from their spouse and says, from the moment we were committed to relationship with one another until today, sitting here, here are all the things that I've done day by day, week by week, month by month to act out my addiction. Here are my secret bank accounts. Here are the not the names, but these are the ways that I've acted out in our relationship. And then when it's over and we have the spouses together, and we have the addicts together, and they're processing. And this one guy goes, oh my gosh, my heart is just hurting. Because usually the spouses are crying their eyes out, and the addicts are feeling like they're walking on air because for the first time in their life they have no secrets from the people that love them the most. And I said, yeah, that's how it affects people. It's like, I just feel like I could puke. And I said, yeah, that happens sometime. Here's a garbage can. And so actually he was having a heart attack. And we were able to move him to the hospital where he was treated. And he had come from, he was an administrator of a big teaching hospital. And so he was very complimentary about the care that he got while he was there. But if we have somebody that just says, I cannot commit to safety, I mean, this is really the bottom for me, to show up at a place like this and say, I can't stop acting out sexually. And we just get them on the van, don't even check them out, go on over to the psychiatric ward, and they can stay there for a few nights until they feel stabilized. We visit them every day, work with them while they're there, and then they come on back. So I'm really proud of that. The program that often our patients will go to after they leave gratitude program is called the Professional Enhancement Program. This program was initially set up to work with disruptive physicians, and now it takes all professionals, but people who are crossing boundaries in the workplace, who are throwing things at people in the operating room, who are just, that person that you cannot do, they're not respectful of perhaps the legal aides that work with them. They can come there and get help. Some of them have addictions, and so they'll go into one of our addiction programs first and then go there to work. But I worked over there for 2 years while they were setting up the sex addiction program there at PineGrove. And part of our monitoring program there is called Pep Care, and we will go on a kind of therapeutic leave with the professionals. So they go into the law office, go into the medical environment, and the therapist will meet with the physician and the head of the hospital, the administrator of the hospital, and it's like group therapy. Here's what you've done to our hospital with your behaviors. Okay? Then they'll go and we have a session with the OR staff. Here's when you did this, when you said that to me, I went home crying. My husband told me to quit my job. And they're like, ugh, they cannot believe it.
And we're transitioning them back into their environment.
Right. They sit down and speak with their own group practice members, and they'll say, our names are ruined in this community because of your behaviors. So then they come back to treatment and talk about what that was like. But the ice has been broken. They're coming back from treatment after they've already kind of had that conversation back at home. And then there's also a monitoring program that we can do after they leave altogether, where they don't know who in their environment has this, but there are people that a message will pop up on their computer on certain days and say, is he dressed? I mean, we can't do a blood work. We can't do, urine screen to see if they're sober. But how is he treating people? What does he look like? Is he on time? Or she? I mean, I'm saying he, but she as well. And so, and we get that feedback on a quarterly basis. And then the other thing that Ruth Ann touched on was that for the rest of a person's life that's come to PineGrove, they can come back. It's almost every other week when you count in the, every other month, when you count in the reunions, but 5 times a year, 2 days free. They're getting therapy, ropes course, psychodrama, and you can just continue to come back to get that booster to give back to the patients who are there. So.
One of the other things I just want to piggyback on to Deborah is what she said is a lot of times we have, in the last couple of years, we have been sending our chronic relapsers also to PEP because it's just been a great add-on to their treatment, and it's really made a difference in the disruptive use that we get and things of that nature. So it's really a good program, and all the programs that we have are good.
Yeah, so I mean, I know like Betty Ford will send us people who act out in treatment.
And we do so many cross referrals with so many of you in this room and outside these rooms. And so, we do, if I had to say one thing, we do what's best for the patient. It's not necessarily always coming to PineGrove, because I refer a lot of patients out, as you know, too. So.
Because what's going on in our society, we're getting more and more calls of people who are under the age of 18 who are already addicted to sex. We send them all to Capstone. Every one of their therapists are trained as certified sex addiction therapists. And that's where it's happening now. And we talk about a tsunami coming. These young people are just exposed to things we can't even imagine. So, and it's changing their brains.
I've personally been involved with them for quite a number of years. All their plants use our monitoring program for like 7 or 8 years, long time. Outcome studies, we monitor them. What I call it is the one-stop shopping. It's like the mall of addiction. And it's amazing. We sat down one day with a napkin at lunch and designed a wheel with the intensives. I put it on a napkin and I said, what we need to do, put all the intensives here, they're all 7 days. And then all these programs they just told me about, as they peel the onion, they say, they really should go with it, because more will be revealed the longer they're in. They're all in there for 3 months or longer. And so they start feeding it, and then they feed it from the outside, and all of a sudden the people from the outside are people with the patients, and it was just amazing. I was staying in a bed and breakfast there, and I told the owner, or the boss at that time, I said, this is owned by a bunch of doctors not in recovery. I tell you, they will go broke, because doctors are not the best business people until they get into recovery. And so they bought it. And
that's where our women's center is. It's very rustic based on her, but it's a bed and breakfast.
It's gorgeous.
The women's center is beautiful.
Then the family stayed next door at another bed and breakfast, which I mentioned, you ought to really go take a look at that for the men's center now. And then move the families other place. But it's amazing. So if you haven't been there, you really need to go for the site visit. Just call her and she'll make arrangements. But they're very dedicated. And I'll tell you, with Forest General sitting there with 2 helicopters, nobody's going to get in trouble. I've had a lady down there who's gotten some serious medical problems. Boom, they were there like that. Any questions, please?
Oh, questions? Come on.
We do have an evaluation center too that we didn't mention.
Yes, it's a full service
for psychosexual evaluation or psychological evaluation.
Comprehensive.
And then also, if somebody can't commit to 45 days, but they're struggling with compulsive behavior, we have a 5-day intensive that really is.
And with our evaluations, if you send a patient to us, and we call them patients because we're a hospital, but if you send it and they come in for an evaluation, we take the price of the evaluation off the price of treatment if they convert to an admission to our facility. A lot of times we're referring them out too.
What is the criteria? What do you take in terms of eating disorders, BMI, ideal body weight?
We do not do feed tubings at our facility. And we do not treat men with eating disorders. So